The silencing of science. A shadow falls on mRNA research. A chilling silence is descending upon the realm of mRNA research, a cutting-edge field poised to revolutionize medicine and conquer diseases like cancer and infectious illnesses. This unsettling development is not the result of scientific limitations, but rather a disturbing confluence of political interference, misinformation, and a blatant disregard for scientific consensus. The alarm bells are ringing loud and clear, emanating from public health experts and scientists who witness firsthand the erosion of crucial research funding, a direct consequence of the current administration's actions. The National Institutes of Health's, NIH, recent request for detailed information on all mRNA research funding has sent shockwaves through the scientific community. This seemingly innocuous request masks a far more sinister intent, viewed by many as a prelude to drastic funding cuts, effectively stifling advancements in a technology with immense potential. This chilling move is widely interpreted as an attempt to control and potentially curtail vital research, fueled by misinformation and conspiracy theories surrounding the COVID-19 vaccine. Whispers within the scientific community paint a picture of bureaucratic roadblocks and outright obstruction. Sources close to the situation, speaking on the condition of anonymity due to fear of reprisal, reveal a climate of fear and uncertainty, where attempts to engage in rational discourse with administration officials have met with complete resistance. The narrative that emerges points to a tightly controlled flow of information, with all grant proposals involving mRNA research funneled through a single point of contact, effectively creating a choke point for any research deemed undesirable by the current administration. This centralized control extends beyond simple information gathering. The administration's decision to review a nearly $600 million contract between the Department of Health and Human Services, HHS, and Moderna, designed to fund mRNA vaccine research against 5 flu subtypes, including the deadly H5N1 avian flu, is further cause for alarm. This review, seemingly prompted by unsubstantiated claims, casts a pall over the future of vital research initiatives. The implications of such actions extend far beyond financial constraints. The potential impact on future disease prevention and treatment is staggering. Consider the overwhelming success of mRNA COVID-19 vaccines. Rigorous studies, like the one conducted by the Commonwealth Fund, have confirmed the life-saving impact of these vaccines, demonstrating that they saved 3.2 million American lives and prevented over 18 million hospitalizations by November 2022. These are not merely statistics. They represent millions of lives saved, families preserved, and a profound testament to the efficacy of mRNA technology. Yet, despite overwhelming evidence of its effectiveness and life-saving potential, mRNA technology is being treated with suspicion and hostility, reminiscent of the treatment of a 4-letter word. This chilling atmosphere is largely attributed to the influence of individuals who have actively spread misinformation and conspiracy theories surrounding the COVID-19 pandemic. Notable figures, such as those involved in the Great Barrington Declaration, have played a significant role in shaping this narrative. The Great Barrington Declaration, a statement advocating against COVID-19 lockdowns and promoting a controversial herd immunity approach, has been widely criticized for its oversimplification of the complexities of the pandemic and its disregard for the vulnerable populations within society. This document, released in October 2020, proposed isolating the elderly and infirm while allowing the rest of the population to resume normal life. The declaration's call for a premature return to normalcy, ignoring the readily apparent lack of widespread immunity and available vaccines at the time, was fundamentally flawed and potentially disastrous. The declaration's naive and ultimately dangerous approach has been roundly condemned by the overwhelming majority of public health experts. Its release, coupled with the subsequent spread of misinformation and conspiracy theories, has created a climate of fear and distrust, which has directly fueled the current attack on mRNA research. The individuals behind this campaign have actively sought to sow doubt and confusion, undermining public confidence in vaccines and scientific consensus. Their efforts have created a fertile ground for the current administration's actions, providing a veneer of legitimacy to otherwise baseless claims. This manufactured crisis jeopardizes the future of scientific innovation and public health. Dr. Jonathan Howard, a New York neurologist who has meticulously tracked medical misinformation for the past 4 years, has voiced serious concerns about the actions and influence of key figures advocating against pandemic measures. His criticism focuses on the deliberate dissemination of misinformation and its profound impact on public health policy. The current situation presents a clear and present danger to the advancement of medical science. The potential consequences of stifling mRNA research are far-reaching and deeply concerning. Not only does it jeopardize the development of new treatments for existing diseases, but it also cripples our ability to respond effectively to future pandemics and other public health emergencies. The silencing of science is not simply an academic matter. It is a direct threat to public health and the well-being of society. The lack of transparency and the deliberate obfuscation surrounding these events underscores a larger issue: the erosion of trust in scientific expertise and evidence-based decision-making. This chilling development necessitates a renewed commitment to supporting scientific research and promoting a culture of open dialogue and transparency within government agencies. The future of medicine hangs in the balance, and inaction is not an option. This situation demands immediate attention and action. We must demand accountability from those responsible for undermining scientific research and jeopardizing public health. The silencing of science cannot be tolerated. The future of medicine depends on the preservation of open inquiry and evidence-based decision-making. The potential benefits of mRNA technology are too significant to ignore, and the risks of allowing political interference to stifle scientific progress are too great to accept. The time for action is now. Contact information: Stephanie, Kirchgiesner at The Guardian, com or signal at 646 886 761.